Most people really do want the vaccine. They want to get back to what we call normal. We know summer's coming. We know people are just going to want to feel more safe and to protect themselves and their families. So the vaccine is one more step that we can move forward and get this done.
Right now in Connecticut, only 6 independents are licensed, and we have 4 of the 6 independents that are licensed to provide the vaccine. I mean, it started early on. We were very involved actually back last year when it first started, and just staying educated on the process, because we were really prepared to take care of all our long-term care clients. And so I had already, back in September, purchased all the freezers, for the Pfizer vaccine and also for the Moderna vaccine, because there's 2 separate freezers for all 4 of our locations. And so we were prepared with writing the manual. We were prepared with educating the staff, because it's a tremendous education process going through all the CE, continuing education we had to take just to be able to do the vaccine.
Nice and loose, quick stick.
So right now we've got the Pfizer vaccine. That's a 2-shot process. That's a 21-day period in between. We've got a Moderna vaccine. That's also a 2-shot process, but it's got a 28-day period in between. We now have, very close at hand, Johnson & Johnson's coming on board, which is a 1-shot vaccine. The Pfizer and the Moderna brand are showing a much higher rate of effectiveness against the original COVID-19 strain. Now, the advantage that Johnson & Johnson is bringing up is that Johnson & Johnson is only 1 shot, and it has also reduced hospitalizations, they feel, more than Pfizer and Moderna.
I think we're pretty fortunate because we've been able to partner with our local pharmacy. They've been approved to be COVID vaccine providers. So many of our residents can call our local pharmacy and make an appointment with them, or they call me and I can help them get an appointment.
Where we're doing it today, we're doing it within the senior center in our community, and to have the space to be able to provide a very safe process that's efficient. Like today, we're going to do 200 shots in about 3.5 hours, and it's seamless. Not more than 3 people are waiting at a time, and they're coming in and out very quickly.
Prior to coming here today, they needed to sign up with Nutmeg, and they were told what time to be here and so forth. And we brought people into the senior center a few at a time so that we could keep social distance. And they did their registration paperwork, and some people needed help. We helped them with it. Once they were done with all their paperwork, we led them into one of the pharmacists that were giving the injections, and once they had the injection, they went into our community room and sat for a minimum of 15 minutes to make sure everything was okay.
What our concerns are is looking at that. Did it get raised to that level of anaphylaxis that we have to worry about? Now, we're prepared for that. Okay, we have an EpiPen available. We've got medical people on staff ready to go if something was to happen. If we're going to beat this, we can't sit there and say, oh geez, I might have a reaction. Well, the reactions have been very minimal.
Everybody, once they've gone through and they've asked one of us a question, or we've led them to Greg and his staff, everybody's felt very comfortable.
The governor's rolled this out in phases because vaccine is in such short supply. The governor has said targeted first was the healthcare professionals, the fire, EMS, police, forward patient-facing people. Then they moved to the 75 and older populations. Now the governor has moved to 65 and older population is now eligible for vaccine. The next phase is expected to be frontline essential employees, and I know there's been a lot of talk about teachers, and we really would like to get the teachers vaccinated, but all that really is dependent on what the governor's phased approach is going to be. And we will do everything we can to reach out to those eligible populations when it comes.
There's a lot of great news, and if we can keep that and keep our vigilance, watch the social distancing, wearing our masks, washing our hands. If we can keep doing that, this is going to be a foregone conclusion, in no time.
As we want to plan and go forward, we're still going to have to be doing the masks for quite a while because we do really need to limit the transmission of this virus to one another. And this is to protect ourselves and our community.